My papers are blank. They have nothing on them. Knock, knock, knock. Hi, my name's Lexi. I'm going to be your student nurse today.
Okay.
Is it okay if I perform a head-to-toe assessment on you?
Yes.
Okay, can I get your name and date of birth?
Ella DeJean, 10/18/05.
And can you tell me what the year is?
2025.
And what city we're in?
Saginaw.
Perfect. You're A&O times 3. Are you allergic to anything?
No.
No. Do you have any current or past medical diagnoses?
No.
Do you have any surgical history?
No.
Do you have any family history?
No.
Do you take any prescription or over-the-counter medications?
No.
Do you take any herbal supplements or vitamins?
No.
No. Tell me about your diet and exercise
I eat
habits.
fruits and vegetables, lots of protein, and I exercise daily.
Okay, what do you do for exercise?
Running.
Running, okay. And just answer this honestly. Do you smoke, drink, vape, or do any drugs?
No.
No? Okay. Those are all the questions I'm gonna ask you. I'm just gonna get a quick set of vitals on you, but
Okay.
first I'm gonna ask, are you in any pain right now?
No.
Okay. I'm gonna get blood pressure first. Do you have a preferred arm?
Left.
Okay. I'm gonna just roll up the sleeve.
Okay.
Okay. Just gonna have you slide your arm in.
Okay. Oops.
Is that too tight for you?
No.
Okay. Okay, you're just gonna feel a little pressure as I inflate the cuff.
Okay.
And I'm listening with the diaphragm of my stethoscope. Okay, I got 110/70.
Okay.
So that is well within the normal range, so I have no concerns with your blood pressure.
Okay.
Next, I am just going to feel your radial pulse
Okay.
for 1 minute.
Okay.
Okay, your radial pulse was 64 and your respirations were 18. So those are well within the normal range, so I have
Okay.
no concerns there. Next, I'm going to assess your hands.
Okay.
I'm assessing for clubbing. I don't see any signs of clubbing. Clubbing is an indication of oxygenation deprivation, but I'm not seeing any signs.
Okay.
If I had a thermometer on me, I would check your temperature. But based on your color and the feel of your forehead, I can assume your temperature is around 98.6,
Okay.
and your oxygenation saturation is between 95 and 100%.
Okay.
Those are all the vitals I'm going to get on you, so we're going to move on to the next section. So I am going to start with your arms, so I'm just going to roll up this sleeve as well.
Okie dokie.
Okay. So first I'm going to start just by inspecting them. So I'm just going to take a look at them. I'm going to lift it.
Okay.
I'm not seeing any moles, freckles, or lesions that I should be concerned with.
Okay.
I'm going to assess for your color looks good. I'm going to assess for temperature.
Okay.
Good. I'm going to assess for even muscle symmetry. Good. I'm going to assess for cap refill. Yep, coming back within 3 seconds, so I can assume that you're perfusing well.
Okay.
Good. Next, we are going to go through a series of strength and range of motion tests.
Okay.
So I'm going to place my hands on your shoulders, and I'm going to have you do a freestyle swimming motion.
Okay.
Good. Any pain or tenderness with that?
No.
I don't feel or hear any crackles or creaks or anything, so I don't have concerns. I am going to have you place your hands like this. Don't let me push in.
Okay.
Don't let me push out.
Okay.
Don't let me push down. And don't let me push up.
Okay.
Any pain or tenderness with that?
Nope.
No. I'm going to have you extend your arms out and flex them and extend them out. Any pain or tenderness?
No.
No. I'm going to have you roll your shoulders back and roll them forward.
Okay.
Any pain or tenderness?
No.
No. I'm going to have you do wrist circles and the other way. Any pain or tenderness with that?
No.
No. I am now going to assess cranial nerve number 11.
Okay.
So I'm going to place my hands on your shoulders and you're going to shrug up.
Okay.
Any pain or tenderness?
No.
No. I'm going to have you shake your head no. Okay. Cranial nerve number 11 is working and intact.
Okay.
Next, I am going to palpate your brachial and radial pulses
Okay.
for symmetry. So I'm just going to have you have your arms like this.
Okay.
Good. Strong and symmetrical. And your radial, strong and symmetrical. Again, that was brachial and radial pulses, both strong and symmetrical.
Okay.
That is going to be all for your arms. Now I'm going to move on to your head.
Okay.
Do you have a history of chronic headaches or migraines?
No.
No. Have you ever had a concussion?
No.
No. Do you have a history or currently have psoriasis or dandruff?
No.
No? Okay. So I'm just gonna take a look. I'm gonna note facial symmetry. Your face looks good, symmetrical, eyebrows are symmetrical. Don't see any concerns there.
Okay.
Now I'm going to just take a peek at your head.
Okay.
So I'm just gonna go through your hair.
Okay.
Good. Not noticing anything abnormal. I'm gonna go to the other side now.
Okay.
Good. Good. Okay. Not noticing anything abnormal.
Okay.
Now I'm going to palpate your head. Please let me know if you feel any pain or tenderness with this. Any pain or tenderness? No? Okay. Now I'm going to palpate all your lymph nodes.
Okay.
Starting with your occipital. Your occipital. Your post-auricular. Your pre-auricular. Your submandibular. Your submental, your cervical. I'm going to assess for tracheal alignment and symmetry.
Okay.
Symmetrical. I'm going to have you kind of shrug your shoulders, your supraclavicular, and I'm going to give you a little small pinch.
Okay.
Good. That's your tissue turgor. I did not notice any signs of tenting, so I'm not concerned about your hydration or anything like that. Now, I am going to assess cranial nerve number 5.
Okay.
So I'm going to just have you remove your glasses real quick.
Okay.
I'm going to touch a few spots on your face, and I'm going to have you tell me where I'm touching.
Okay.
And I'm going to have you close your eyes.
Okay. Forehead, left cheek, right cheek, nose, chin.
Good. And now I'm going to just hold your jaw, and I'm going to have you open your mouth and close it. Good. Cranial nerve number 5 is working and intact.
Okay.
So I have no concerns with that. So I'm going to move on to your eyes now.
Okay.
So I noticed you wear glasses. Do you also wear contacts as well?
No, just glasses.
Just glasses, okay. And do you see the eye doctor yearly?
Yes.
Yeah. Have there been any big changes in prescription that you've noticed?
No.
No. Have you noticed any drainage, swelling, inflammation, itchiness, dryness with your
No.
eyes? No. Lastly, are you sensitive to light?
No.
No? Okay. So first, I'm just going to inspect your eyes. Looks good. I'm not seeing any drainage, no inflammation, redness, swelling, anything like that. Now I'm just going to check with the light. So I'm going to have you look up, and I'm going to pull down. Good. Good. Now I'm going to have you look down, and I'm going to pull up. Good. Good. Okay. Your conjunctiva is pink, and your sclera is white, so I have no concerns there. Next, I'm going to assess cranial nerves number 3, 4, and 6.
Okay.
So I'm going to have you just look at me, and I'm going to shine a light
Okay.
and assess. So just look at me.
Okay.
Good. Good. Your eye's constricted, so I have no concerns with that.
Okay.
Next, I'm going to assess your 6 cardinal fields of gaze.
Okay.
So I'm going to have you just follow my pen light with your eyes, but not your head.
Okay.
Good. I have no concerns there.
Okay.
Next, I'm going to check for accommodation. So I'm going to have you just look at me
Okay.
and look at my pen light and look at me. Very good. Your eyes accommodated. No concerns there. Next, I'm going to check reflection. So I'm going to just have you look at me.
Okay.
Good. Your eyes, I see the reflection. So I can say your pupils are equal, round, reactive to light, and accommodating.
Okay.
Next, I'm going to assess cerebellar function.
Okay.
So I'm going to have you place your hands on your lap and flip them over and as fast as you can. Good. Now I'm going to have you make the OK sign and down your pinky and back up and do that as fast as you can. Good. I am now going to, I'm going to have you touch your nose and touch my pen light, touch your nose, touch my pen light, touch your nose, touch my pen light, touch your nose.
Okay.
Very good. Along with cerebellar function would be the Romberg test, which is cranial nerve number 8, but we are going to do that at the end of the head to toe. And the sharp and dull test is cerebellar function, but we are also going to do that towards the end of the head to toe. So that is going to be all for your eyes.
Okay.
I'm going to move on to your nose now. Have you ever broken your nose?
No.
Have you ever had surgery or plastic surgery on your nose?
No.
I noticed you have a nose ring. Does that ever get infected often or ever give you trouble,
No.
pain, nothing like that? Okay. And do you have like chronic bloody noses?
Mm-mm.
No? Okay. So I am just going to start off by inspecting it. So I'm going to give you a little piggy nose and look up.
Okay.
Okay. I don't see any polyps. Your septum is not deviated. You have a presence of turbinates. And your mucosa is moist.
Okay.
So I don't have any problems with that. Next, I am going to have you remove your glasses real quick.
Okay.
And I'm going to palpate your sinuses, starting with your frontal
Okay.
and your maxillary.
Okay.
Any pain or tenderness with that?
No.
No? Okay, next I'm going to test cranial nerve number 1. So I'm going to have you close your eyes, and I'm going to waft a scent in front of your face, and you're going to tell me what it is.
Okay. Cinnamon.
Very good. Cranial nerve number 1 is working and intact. Now I'm going to move on to your ears.
Okay.
Do you have a history of chronic ear infections?
No.
Have you ever had tubes placed?
No.
I can assume you're not hard of hearing because we've been having a conversation, but have you ever noticed you're hard of hearing, or has anyone ever told you you're hard of hearing?
No.
No? Okay. Then I'm going to begin by inspecting them.
Okay.
So I am just going to take a look. I'm going to move this hair. I'm going to pull the pinna back and up. Take a look inside. Looks good. I'm going to palpate. Any pain or tenderness?
Nope.
I noticed you have piercings. Do those ever get infected a lot or give you any trouble?
No.
No? Okay. Again, same thing. I'm going to pull the pin up, back and up. And look. Looks good. I'm going to palpate. Any pain or tenderness?
Nope.
No? Okay. Again, like I've said, cranial nerve number 8 is the hearing cranial nerve, but we're going to assess that at the end of the head to toe. Now I'm going to move on to your mouth.
Okay.
Are you having any trouble swallowing or anything like that?
No.
Have you ever had your tonsils removed?
No.
Okay. I'm going to just have you open up. I'm going to take a look. Okay, I see your uvula, your hard and soft palate, your mucosa is moist, and your teeth look good. No concerns there.
Okay.
Now I'm going to have you just pull down your bottom lip, and I'm going to inspect. Looks good. Now I'm going to assess cranial nerves number 9 and 10.
Okay.
So I am going to depress your tongue, and I am going to have you say ah, and I'm going to just take a look inside.
Okay.
So I'm going to have you open and say ah.
Ah.
Very good. Your uvula rose on phonation, so I have no concerns with cranial nerves number 9 and 10. They're intact
Okay.
and working. Next, I'm going to assess cranial nerve number 12.
Okay.
So I'm going to have you stick your tongue out and wiggle it side to side. Good. Cranial nerve number 12 is intact and working.
Okay.
I'm now going to assess cranial nerve number 7. This one's kind of a fun one. You need to make a few funny faces.
Okay.
So I'm going to have you smile, frown, puff out your cheeks, and raise your eyebrows. Very good. Cranial nerve number 7 is intact and working. That is going to be all for your mouth.
Okay.
Now I'm going to move on to your neck.
Okay.
So I am going to just start by feeling your carotid pulses one at a time.
Okay.
So I'm going to just move your hair out of the way.
Go for it.
I'm going to feel one at a time. Good, strong. Good, strong. Now I'm going to auscultate them with my stethoscope. So I'm going to be listening for whooshing through the stethoscope.
Okay.
That would indicate something called a bruit, which is an obstruction in your artery that could lead me to be concerned with an aneurysm.
Okay.
I am listening with the bell of my stethoscope. No whooshing. Other carotid. No whooshing.
Okay.
So I'm not concerned with any presence of bruits. Okay. I'm going to just check my paper before we continue the rest of the assessment. Okay. 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 Now I feel comfortable moving on to the next section, which is your thyroid and your lungs. So I'm going to have you sit crisscross applesauce in the bed and face this way. Okay. Yep. So this is, I'm going to be checking your thyroid. Have you ever had any issues with your thyroid?
No.
Okay. I am going to have my hands around your neck. I'm not choking you,
Okay.
but I just want to let you know because sometimes it can be a scary feeling.
Okay.
So I am going to just feel for the prominence. Good. Right there. And I'm going to displace and palpate. Good. And displace and palpate. Good. I don't feel any issues with that, so I'm not concerned with anything regarding your thyroid.
Okay.
So now I'm going to have you stay crisscross, but I'm going to have you face that wall right there. And you can come over here. Perfect. Okay. Is it okay if I untie your gown?
Yes.
Okay. This is just the respiratory assessment of the head to toe.
Okay.
Do you have any respiratory issues like asthma or COPD?
No.
No? Okay. I am going to, is it okay if I unclasp your bra?
Yes.
Okay. Perfect. And I will reclasp that at the end.
Okay.
So first I'm going to start just by finding your lungs. So I'm going to place my hands down here and I'm going to have you take a deep breath in. And out. Good. And in and out. Good. So I can assume your lungs are right here. Okay. So I'm going to start by percussing 12 spots on your back.
Okay.
It'll be 6 spots on each lung, and I will be listening for resonance.
Okay.
This won't hurt. It's just going to feel like me tapping on your back.
Okay.
Okay. Can you kind of sit up and kind of flex your scapula? Perfect. Okay, now you can go back and relax. Okay. So now I'm just going to begin percussing, listening for resonance. Okay, I heard resonance in all 12 spots on your lungs.
Okay.
So now I'm going to auscultate them.
Okay.
I'm going to be listening, excuse me, I'm going to be listening in the same 12 spots that I just percussed in. I'm going to place the stethoscope, and I'm going to have you take a deep breath in and out every time I place the stethoscope.
Okay.
I will let you know when I'm halfway through after spot number 6 if you want a break to catch your breath or anything like that. If you need a break earlier than that or after that, just raise your hand, let me know, and I will stop.
Okay.
Okay. I will be listening with the diaphragm of my stethoscope. Okay. So I'm just going to have you take a deep breath in and out. Good. Okay, that is the halfway point. Do you need a break to catch your breath?
No, I'm good.
Okay. Very good. Your lung sounds are clear in all 12 spots. I didn't hear any crackles or wheezes,
Okay.
so I have no concerns with your lungs.
Okay.
So now I feel comfortable moving on to cardiac, so I'm just going to reclasp your bra.
Okay.
And I'm just going to pull you down like this. We're going to have to lower it again, so
Okay.
is it okay if I just leave it?
Yeah, you're good.
Okay. Go like this, and I'm going to have you put your head down here at the side of the bed, and your feet will just go this way. I'll move some of this stuff for you.
I'm gonna lay all the way down.
Yes, if you could lay all the way down without your head on the pillow for right now. Okay, so I'm gonna have you just look that way and look this way. Good. I'm looking for jugular vein distension. If I saw a jugular vein distension, I would move the head of the bed up to 45 degrees and reassess.
Okay.
Okay, now I'm gonna put your pillow back, and you can kind of sit up just a little bit more, just laying down, but you can kind of sit, you can scoot yourself up just a little bit. Very good.
Okay.
Okay, now I'm gonna begin the cardiac assessment. Do you have any history or family history of hypertension, high cholesterol, heart failure, heart attack, anything like that?
No.
Coronary artery disease? No. Have you ever noticed any issues with your heart that you want me to be aware of?
No.
No? Okay. Then I feel comfortable continuing the assessment.
Okay.
Is it okay if I draw your gown down?
Yeah.
Okay. There we go. Okay. Good. First, I'm just going to start off by inspecting the skin, Not seeing any moles, lesions, anything to be concerned of.
Okay.
So I feel comfortable continuing. So I'm going to listen to 5 spots on your chest: your aortic, pulmonic, herbs, tricuspid, and mitral.
Okay.
Then I'm going to be listening to your apical pulse for 1 minute.
Okay.
And I'm going to be counting each rib space and intercostal space as I go.
Okay.
So I'm going to start with the aortic. So
Okay.
I'm going to start on the right side of the patient at the right clavicle, subclavicular space, first rib, first space, second rib, second intercostal space. So this is where your aortic is, so I'm going to listen.
Okay.
Okay. I'm going to be listening with the diaphragm of my stethoscope. Good. S1, S2 sounds are present. Now I'm going to flip to the bell and listen for murmurs. I don't hear any murmurs. So again, that's the aortic. Now I'm going to move on to the left side of the patient.
Okay.
At the left clavicle, subclavicular space, first rib, first space, second rib, second space right here. And I'm going to listen to the pulmonic with the diaphragm of my stethoscope. S1, S2 sounds are present, flipping to the bell, listening for murmurs. Okay. I didn't hear any murmurs. So now I'm gonna go third rib, third intercostal space. So this is herbs. I'm going to be listening with the diaphragm of my stethoscope. Okay. S1, S2 sounds present, flipping to the bell, listening for murmurs. Okay, no murmurs. Continuing, I'm going to go fourth rib, fourth intercostal space. This is tricuspid. I'm going to listen with the diaphragm of my stethoscope. S1, S2 sounds are present, flipping to the bell, listening for murmurs. I didn't hear any murmurs. Now going down, I'm going to count fifth rib, fifth intercostal space. Then I'm going to go mid-clavicular. Well, I'm actually going to find it with my finger, meet in the middle. Mid-clavicular, slide over. This is mitral. I'm going to listen with the diaphragm of my stethoscope. My stethoscope is right here. Okay. Now I'm going to flip to the bell, listening for murmurs. Okay. Stethoscope is right here. Okay. I don't hear any murmurs. Now I'm going to flip back to the diaphragm and listen to the apical pulse for 1 minute. Your apical pulse was 68,
Okay.
and I heard S1, S2 sounds at all 5 placements, and I heard no murmurs.
Okay.
Just to reiterate, starting on the right side of the patient, it was aortic. Moving to the left side, it was pulmonic, herbs, tricuspid, mitral, and then I listened to your apical pulse for 1 minute. That is going to conclude the cardiac section, so I'm going to just pull your gown back up.
Okay.
And now we're going to be moving on to the abdomen section.
Okay.
So do you mind if I lift your gown to expose your abdomen?
Okay.
Perfect. There we go. Yeah, it's a little bit hard. Okay. And then do you mind pulling down your waist to kind of be at like a low-rise position so I can see your full abdomen? Perfect. Awesome. Okay. So I am going to just ask a question. It's a little bit uncomfortable. Just try to be answer it to the best of your ability. How many bowel movements are you having every day?
2.
2? Okay. And can you kind of describe it to me? Is it brown? Is it red? Is it hard, soft?
Brown and soft.
Is it brown and soft? And no pain while going to the bathroom?
No.
No, nothing like that? Okay. Is there anything you want me to know about your abdomen before we begin? No pain?
No.
No? Okay. So first I'm going to start by just inspecting the abdomen.
Okay.
Just going to look, not seeing anything concerning, no moles, freckles, lesions I should be concerned about. Next, I'm going to step to the end of the bed, and I am going to check for the aorta pulsating. Yep, I see your aorta pulsating, so that's good. Now I'm going to come back.
Okay.
And first, I am going to auscultate all 4 quadrants of your abdomen, just for bowel sounds. So this is going to be 3 to 5 gurgles just to check your GI motility, make sure there's no obstruction. Okay. I'm going to begin in the right lower quadrant and move clockwise from the right lower quadrant to the right upper, and left lower. Again, listening with the diaphragm of my stethoscope. Three to 5 gurgles, moving to the right upper quadrant. Three to 5 gurgles, moving to the left upper quadrant. Three to 5 gurgles, moving to the left lower quadrant. Three to 5 gurgles. Okay, so bowel sounds are present and active in all 4 quadrants, so that would indicate no GI obstruction or anything like that. Next, I'm going to auscultate your abdominal arteries. So I'm going to begin with the aorta and then move to the left and right renal artery, and then to the right and left iliac artery. Okay. So first, I am going to just find your aorta. So it's going to be halfway between your umbilicus and your xiphoid process right here, and meet in the middle. I'm going to be listening with the bell of my stethoscope just for any bruits. With the bell of my stethoscope. Okay, no whooshing, so I'm going to move to the left renal artery, right here, with the bell of my stethoscope. Okay, no whooshing. Moving to the right renal artery with the bell of my stethoscope. Okay. Moving to the right iliac artery. Listening with the bell of my stethoscope. No whooshing. And now the left iliac artery with the bell of my stethoscope. Okay, no whooshing. So just to reiterate, I heard no whooshing in your aortic artery, your right or left renal, and your right or left iliac. Again, this is the left side of the patient. This is the right side of the patient. Okay, now I'm going to percuss your abdomen in all 4 quadrants. So this is very similar to what I did with your lungs, except this time I'll be listening for tympany.
Okay.
So I'm going to start in the right lower quadrant, go clockwise, so right lower, right upper, left lower. Okay, I heard tympany in all 4 quadrants. Now I'm going to percuss your abdomen until I find your liver border.
Okay.
Starting in the right lower quadrant. Okay, so this is where it turned from tympany to dull, so your liver border is right here. Okay. Now I'm going to perform light palpation on your abdomen, starting in the right lower quadrant and moving clockwise, just as I have been doing. Please let me know if you feel any pain or tenderness with this. Any pain or tenderness?
Mm-hmm.
Okay, now I'm going to do deep palpation. Same thing, right lower quadrant, moving clockwise. Let me know if you feel any pain or tenderness with this, please.
Okay.
Any pain or tenderness?
Mm-mm.
Okay. That is going to conclude the abdominal section. So I am going to just pull your gown down to cover your abdomen. I'm going to move on to your legs now. So first I am going to just assess your legs.
Okay.
So I'm just going to look at them. I'm noting color, moles, freckles, lesions, which I'm not seeing. Do you mind if I remove your socks?
Mm-mm.
Okay. Okay. Again, noting any moles, freckles, lesions, not seeing anything concerning. Now I'm going to assess for temperature. Color looks good as well. I'm going to assess for temperature. Good. Temperature feels good. Now I'm going to feel for even muscle tone and symmetry, along with edema. Good. Muscle symmetry is even, and I don't see any signs of edema. So now I am going to feel all of your pulses,
Okay.
starting with your femoral. So this one's a little bit uncomfortable because I do have to kind of have my hands in your pants, but I'll make it as quick as possible. Do you mind if I pull your gown up?
I don't care.
Okay. So first I am going to start by just feeling for your femoral pulses. I'm going to do this one first, and then I'm going to test for symmetry, and then I'm going to take my hands out, I'm going to get my stethoscope, and then I'm going to find them again and listen to them for groovies. Okay?
Okay.
Okay, do you mind if I lift your shorts?
I don't mind at all.
Okay. Okay, found that. I'm going to go to the other one and assess for symmetry.
Okay.
Okay, I found them. They are strong and symmetrical. My finger is right here. Now I'm going to get my stethoscope and I'm going to be listening with the bell. Again, I'll be listening for whooshing, which would indicate the presence of a bruit, which I would be concerned with an aneurysm at that point. Okay, listening with the bell. So I'm going to find it again first.
Okay.
Okay. My stethoscope is right here. Okay, no whooshing. Now I'm going to do the other side. I'm going to find it first. Okay. Now I'm going to auscultate with the bell. My stethoscope is right here. Okay. No whooshing, so I'm not concerned with any sort of bruit at all.
Okay.
I'm going to lift your gown back down.
Okay.
Now I'm going to feel for all your pulses in your legs. So I'm going to start with your popliteal pulse, which is behind your knees. Just going to feel. Yep, strong and symmetrical. Now I'm going to just come to the edge of the bed. And I'm going to feel for your posterior tibialis. Good, strong and symmetrical. And your dorsalis pedis. Good, strong and symmetrical. Okay, now I am going to just inspect your toes. If you don't mind, I'm just going to look in between each one.
Okay.
Good. Good. Okay, and now I'm just going to assess cap refill in your toes.
Okay.
Good. Cap refill is coming back within 3 seconds, so I can assume you're perfusing well, which is good. Next, this is a part of the leg section and your cerebellar function. I'm going to perform a sharp and dull test.
Okay.
So what I'm going to do is I'm going to touch some spots on your legs and feet.
Okay.
And it's going to be, you're going to tell me where it is and if it's sharp or dull.
Okay.
So for the sake of this, you can call this your thigh, knees, shin, top of foot, bottom of foot.
Okay.
And this is going to be sharp.
Okay.
And this is going to be dull.
Okay.
Okay. So I'm going to have you close your eyes.
Okay.
And we'll begin.
Sharp left thigh. Sharp right knee. Sharp left top of foot. Sharp right bottom of foot. Sharp right thigh. Sharp right knee. Sharp right top of foot. Sharp left thigh. Sharp left shin. Sharp right shin.
Okay. Well, you got a few of them wrong, but that's okay. That's totally normal. Sometimes that happens. You got the majority of them correct, so I'm not concerned with any sort of peripheral neuropathy. So, says for edema and everything. Okay. I believe this is all for the leg section.
Okay.
So I'm going to put your socks back on.
Okay.
Okay. Okay.
Okay.
So I'm going to have you sit up and just like in the same position we started in, just swing your legs over. Please don't touch the ground.
Okay.
Okay. Like this. So like I said in the beginning, when we tested cerebellar function, we are going to be testing that again with the sharp and dull test, which was cerebellar function, and we're about to perform the Romberg test, which is cranial nerve number 8 and a part of cerebellar function. Before I do that, I'm going to assess for edema because we switched positions.
Okay.
Okay, no sign of edema. Next, I'm going to test some of the range of motion and muscle strength of your legs.
Okay.
So just like I did with our hands, I'm going to do the same thing with your legs. I'm going to start at your knees and your ankles.
Okay.
So I'm going to have you don't let me push in.
Okay.
Don't let me push out. It's a little bit tricky, but don't let me push down.
Okay.
And then don't let me push up. Good. Okay, now I'm going to do the same thing at your ankles. Don't let me push in.
Okay.
Don't let me push out. Don't let me push down. And don't let me push up. Very good. Okay, no concerns there. I am going to have you do ankle circles just like we did with our wrists and the other way. Any pain or tenderness with that?
No.
No? Okay. Now I'm going to test your patellar reflex.
Okay.
So I'm going to come over here out of the way. Find it right here. Okay, I saw the little flinch. Moving on to the next leg. Very good. Light patellar reflexes, but they're definitely there. Okay, now I'm going to put your shoes on.
Okay.
Okay, yeah, I'll loosen them. They're a little bit tight. It's a little bit hard. You can kind of push on my leg if you need.
I help.
Yeah, you can push down a little bit. There you go. We got it. Sometimes it's a little bit hard since your legs are kind of hanging and you're probably used to putting them on your own, but that's okay.
Thank you.
I'll loosen up this one. Okay. There we go. Okay. So now I'm going to have you stand up.
Okay.
And I am going to tie your gown real quick.
Perfect.
Do you feel dizzy at all right now?
No.
Okay. So you can stand facing this way. So we're going to perform the Romberg test.
Okay.
So I'm going to have you stand with your feet shoulder width apart. And I'm going to have you close your eyes and try to balance the best you can for 30 seconds. Okay, it's been 30 seconds. You can open your eyes. I noticed minimal swaying, so I'm going to say that your Romberg test is negative, so I feel comfortable walking you.
Okay.
So I'm going to have you step in front of your fan real quick and face this way.
Okay.
And we are going to walk just to the edge of the bed, just normal walking.
Okay.
Good. And now I'm going to have you turn around. And before you walk, I'm going to show you, I want you to walk back to where we were, heel to toe like this.
Okay.
All right, go ahead. Good. Very good. Your gait looks normal. So I think you're walking good and normal. You can turn around for me. I am going to give you a Braden scale score of 23 because you are not sedentary, you are active, you eat a healthy diet with fruits and vegetables, you're not incontinent. So I have no concerns with bed sores or pressure ulcers.
Okay.
This concludes the head to toe assessment. Thank you so much. Good.